Hello, swimmers and triathletes. This is Coach Caron coming to you again with our spotlight for December. I can't believe we're at the end of the year already. And today we are talking to Dr. Dan McGuffie of Connections Physical Therapy. So welcome.
Well, thank you so much, Coach Caron. Yeah, I'm really excited to be here. Thank you for making me a part of this.
Oh, you're welcome. And we are on site today at Dr. Dan's new office in Amherst, but you also have an office in Merrimack.
I do, and that's actually where we started, kind of right down the road from your facility there.
Yeah.
Literally right down the road,
Exactly.
right off the hill. So yeah, we started out in Merrimack, just opened up our clinic here in Amherst a couple months ago. Yeah.
Well, congratulations.
Well, thank you. No, we're very excited about it. Excited to see the growth there. Connections has been around for a long time, so we're excited that New Hampshire is catching on.
All right.
Yeah.
So every once in a while, we need to enlist the help of a physical therapist. I know I have several times in my swimming career. So when should somebody think about coming to a physical therapist?
Well, a couple times. I'll answer that in a couple different ways. The obvious one is when you're not swimming the way that you used to, right? I mean, you're having pain. Maybe you notice as the coach that your stroke has changed or you're compensating, right? So there's a problem to be fixed. The other side would be kind of before a season starts. You know, maybe you had trouble last year and you want to stay on top of that and kind of be preemptive about preventing a shoulder dysfunction, preventing pain. And honestly, being such a skilled swim coach as you are, that you might see that before it becomes a true issue. Maybe you see a little bit of tightness, maybe their reach isn't as far, and that's when you want someone to come in and be preemptive about it. Don't just wait until that shoulder keeps getting worse and worse and you go, oh, it'll go away. But then it doesn't, right? So now you're a month ago, and maybe we could have fixed this in 2-3 weeks. Now we've got 4, 6, 8 weeks of rehab to do. So a couple different ways there. When something obviously goes awry, let's fix it. Or you know what? If we can stay on top of it, and maybe somebody who's watching you swim catches on, you know what, something looks a little different, or your speed goes down, even just if you're practicing on your own, maybe your speed, your lap time goes down. Something has changed and not for the better. So that's when I would definitely pop in and say, you know what, physical therapy might be a good place to go.
Yeah, and it's great to answer that question of I don't know what's going on, to come in and have Dr. Dan take a look and say, oh, this is why this is happening, and to give you that insight, and he will definitely help you to know what steps should be taken to get you back to where you were. And we all want to get back to where we were as fast as possible.
Right, so that we can continue to improve. Exactly.
Yes.
Exactly.
But without the pain.
And there you go. You don't want to have the pain, you don't want to have that dysfunction, but you're right. You want to get in there, you want to catch things early as possible, and so you don't have to slow down.
Great.
Yeah.
So what makes Connections Physical Therapy different from maybe other physical therapy offices, or why would somebody come see you?
So one thing I love about Connections Physical Therapy, and actually I moved here recently, or not recently, but I moved here and I'd worked in a bunch of different other PT clinics as a traveling therapist. And one thing that's very unique about Connections is that we're all one-to-one treatment. Just like how you treat your swimmers, we're all one-to-one. We don't share time. You're always going to see a highly skilled therapist when you come into the clinics, and we're not going to share time, right? We're right there with you. We're making sure your exercises are going well, and especially for your higher level athletes who are really pushing themselves. You know better than anyone, one little tweak could be the difference between a good run and a bad run, or a good season and a bad season. And you want to catch that early. And if you're just handed a piece of paper that says, okay, I'll go do these 10 exercises and I'll be back in 20 minutes, to me, that's not good care. And at Connections, we really take that time to work one-to-one with you and say, you know what, let's tweak this right out of the gate so you don't develop any bad habits, and we can take you through that continuum of care and have great success with that. And I'd say that's what really sets us apart from a lot of other groups, especially in this area here in New Hampshire.
Definitely. And you guys are spoiled with me working on you one-on-one. And so Dr. Dan is going to do the same thing. And he's right. If he looks at something that you're doing and you're doing an exercise and maybe you're not using quite the right muscle groups, since he's working with you one-on-one, he's going to notice that right away. And he's not going to let you get away with being lazy on those exercises.
No.
But that's what's going to help you move forward, and that's what's going to help you get that power and that speed that we're working on in the pool, is by using those correct muscle groups. And you guys know that I harp on that all the time.
Yes.
So
Yes.
to have somebody else, pointing that out to you, or pointing out that, oh, if you just do this with a concentration of being heavy in your heels, then you'll get the right muscle that you're looking for. That might not be something that somebody else who just kind of gave you the exercises would have picked up on.
Catch up on.
So
yeah,
I like that.
Absolutely, and I mean you hit the nail on the head there. Is you need to catch that sign early and get rid of it.
Yes.
Right? And another great thing is that because as a patient to therapist relationship, we catch something, we find out what's wrong. You're going to be with me. I can talk to you and say that this communication right here between you and I is huge. And so maybe their problem isn't something, or your problem isn't something that makes you come out of the water. Mm-hmm. Maybe you can keep swimming, but I can talk to you as their coach and say, well, this is what the problem is. This is how we're going to fix it in PT. Let's see what we can do from the swimming side, because you're the expert in that. I'll get their body hopefully fine-tuned, and then you can run with that as their coach to continue to improve every aspect of their swim or their competition.
Yes, and that's very valuable information for me. I can take that and put that into the water and get you your better results even faster. So I love the fact that we can work together on that and communicate. So as we get older, we still want to train as if we were younger. What are some tips that you can give us for continuing to train intensely like we're used to, but still being able to preserve our bodies so that we can still get up in the morning and go to work?
Absolutely. And I'd say my number one tip for that, for anything, swimmers or runners, bikers, you got your triathletes who do all three, right? Is recovery. If you don't let yourself recover, your body is going to wear down. If your body wears down, then you have pains, and then you stop what you're doing, right? And that's what I see with a lot of people, and not only older people, but definitely on the older people as a whole, is they push themselves, like you said. Maybe they're not training as often, or they don't have the eyes that they used to with a skilled swim coach, right? Mm-hmm. And so they think they know what's going on, right? They push through that pain and they don't let themselves recover. And they say, well, okay, maybe I'm not competing at the level I used to. I don't need to go get this checked out because, well, why? Right? But no, you have to recover. You have to take those little injuries, those little nuances, those little changes seriously so they don't become a bigger problem. And that honestly is my biggest tip, is you have to recover and you have to cross-train. And if you just swim all day, every day, well, guess what? Something's going to wear out. Something that you use swimming is going to wear out. That's true with every athlete. We just talked about this a little bit off camera. Whether you're a baseball pitcher or a soccer player or a track star, if you do that all day, every day, 365 a year, you're going to wear down. Right. You need that chance to recover. And a swimmer, what's great for them? They get on a bike, or they run, or they lift weights. That's good to cross-train, target the body, get those muscles working in a different way, so that they have a chance to rebound. You get to strengthen them from all angles, and they're not just being stressed over and over and over the same way.
So very important to take that dry land seriously. do your core, your glute exercises, but also take that taper week that's built in to your program, take that seriously. Taper week is not a week to just say, oh, okay, I'm taking a vacation. It's actually, you're still working, but you're allowing your body to recover. You're allowing your muscles to catch up to all the work that you've been doing to make yourself stronger.
Right.
So that's why I build in that taper week, so you guys can actually come back from that week and be stronger and keep moving forward.
And our bodies, very well said, and our bodies are really good at responding to good amount of stress. I mean, that's how we build muscle. That's how we gain strength, right? You give the body enough resistance so that it has to improve itself, so the next time you go and do it, it's better. But
Yes.
guess what? That body to improve has to have time to recover.
Yes.
If you don't give it that, you miss that whole section of that improvement.
Yes.
Yeah.
Yes. What can they expect when they come to see you?
What can they expect? So, right out of the gate, we're going to do a very thorough evaluation. We're going to get to know you, kind of why are you coming here to see me today? Now, is it something that you want to be preventive about? Is it something that you're dealing with right now? Or is it something that, you know what, you've had for a long time and you don't know why it's not gone yet? And so that's the first thing we're going to do, is we're going to evaluate the situation, see what we're working with. And so you'll meet with me, you'll fill out, some medical paperwork, and then I'm going to ask you a lot of questions. I'm going to watch you move, test your strength, test your flexibility, make sure that your body can move the right way, and then come up with a detailed plan on how we're going to get you back to where you want to be, and see, okay, well, is this something that we're going to fix in physical therapy, or is this something that's, that maybe needs some more attention? But we're going to find that plan, that detailed outline on what are we going to do and how are we going to approach this.
Excellent.
Yeah.
So if somebody doesn't know where to start, are you a good first step?
I would say so. I would
Okay.
say you'd be surprised at how many doctors, whether it's your primary cares, your orthopedics, say, you know what, why don't we try physical therapy first? See what we can do, how the body can help itself, with some good instruction. So you're going to start there most likely anyway, and then if for some reason, and I tell every one of my patients, I have this timeline that I'm expecting you to get better with. Some are longer, some are shorter. If you're not following that timeline, there's a little gray area. Maybe some people take a little longer to recover than others. But if you're not following that timeline, well, guess what? Maybe we need a little extra help from somebody else or another set of eyes. But I think physical therapy is a great place to get that first look. And if you get that first look from a PT, what we're going to do is communicate that to a doctor. We're going to communicate that to your coach. And we're going to know what that next step is. And most people in New Hampshire, we're in a state where you can do this, is you don't need a referral to come see me. You can just come off the street and see me. The referrals are usually insurance-based. Those are usually requirements for insurances. But you can come in off the street and just come and see me. Give us a call, and you can come see me there, and then we can help dictate kind of what goes next.
Okay.
Yeah.
All right. Well, that sounds good. So what would you say is your biggest pride about your business?
Biggest pride about my business is our ability to absolutely communicate with the patient and get involved in their community parts. I mean, like for example, a swimmer of yours comes to see me, I am communicating with you. I'm communicating with their doctor, and if it's a child, right? I'm communicating with their family, and we get this whole approach so that everybody's on board. And with our one-to-one treatment, we have that ability.
Well, how would somebody get a hold of you?
Well, the easiest way is to give us a call. At our phone number. Again, if you're closer to Merrimack or closer to Amherst, you can we can get you those numbers there. And I mean that's the easiest way. Get the ball rolling, or you can come in and say hi. We've got time set aside for people to come by if you're not sure kind of what's going on, even especially down into the Merrimack clinic and even up here in Amherst as well. I do screens. You know, somebody says, you know what, I kind of tweaked my shoulder yesterday. Is it something I need to worry about, something I need to see you for, or is it really something that will go away on its own? And so sometimes people will come right down and introduce themselves to me. And I love that. I love being able to see that. Over the phone, you can only get so much detail, but in person, it's fantastic. But I'd say the easiest way to get a hold of us is give us a call, and we'll take care of you from there.
Okay.
Yeah.
Excellent.
Yeah.
Right. Well, thank you so much for having me in.
Coach, no, it was absolutely, I mean, I'm seriously, it's my pleasure. It's always great seeing you, and I know you do great work with your athletes, and you're always pushing each person to their potential. And if anyone ever needs
beyond.
and beyond, right? And if there's ever anything I can do to help, please just let me know.
Oh, definitely. I will.
No, thank you.
So I hope you guys have an excellent holiday season. It is the end of the year, and next month we're going to be talking about setting goals. So I want you guys to think about what's your goal for next year, and is there something that's standing in your way? And that's something that either I or Dr. Dan can help you with if it's something physical. And keep in mind too that a goal doesn't have to be a swimming goal. For me, I can work with you on your personal goals, on your nutrition goals. So I want you to start thinking about that, because I'm going to be asking you that when you come into the pool. But until then, I hope you guys have a great holiday season, and I'll see you in January.